According to the country's Special Committee for Ensuring Access to Covid-19 Vaccine Supply JKJAV, based on the data from the Covid-19 Immunisation Task Force CITF, a total of 29.2% of the country's total population had received their first doses, while 13.5% of the country's total population had been given their second doses as of July 17. CITF said Selangor reported the highest daily number of Covid-19 vaccine shots for the first dose, then followed by Kuala Lumpur. Malaysia's Covid-19 vaccination scheme started on February 24 this year, and its target to get 80% of Malaysia's population to be fully vaccinated to achieve its herd immunity. The country's population stands at about 33 million people, therefore a total of 26 million people left to be fully vaccinated against the pandemic to achieve its target. Virologist Professor Dr. Sandy Loh of University Nottingham, Malaysia told The Sun that vaccines will prevent severe illnesses, but it appears to be less effective against Delta variant. She cited the recent data for the AstraZeneca vaccine, which showed that a single dose would be 33% effective against the Delta infections, while 2 doses would increase its effectiveness to 60%. As for Pfizer vaccine, she said a single dose would be 33% effective at preventing severe illnesses caused by Delta variant, while 2 doses would provide 88% of its effectiveness to protect symptomatic diseases. Basically, she said vaccines can still protect patients from reaching category 4 and 5, which is hospitalizations and ICUs. She then urged Malaysians to get vaccinated and reminded that those who have been vaccinated may still get COVID infection. Therefore, she said to never loosen the standard operating procedures SOP during this pandemic.
Then sometimes the duties tend to be very superstitious of that. That is something that in Taoism we do not encourage. Actually, we are asked to just always to seek the truth and never be superstitious, because you must be having a very clear mind, and with a good understanding of the teaching of Taoism, you will never be superstitious. Everything has a reason. Find the reason, find the truth. There are many time-tested Chinese herbal medicine that have been proven that I would say should complement the vaccine that we are going to get. And, many of our leaders, or rather our committee in temples, they are elderly, you see, 60 and above, and I've checked with them. Most of them registered, and some of them already vaccinated. You see, we have a WhatsApp group, and then among us we will post information about the COVID, information about the vaccine, and why the need for vaccination, which to us is very, very important. What I worry most is that the pace of vaccination is still not good enough, because I read from papers there are something like 3 million, it's only 10% of the population. That is far from hitting the herd immunity that the government aims for. So we hope that the immunization process can be hastened up so that more people are vaccinated and protected.
Of course, I do encounter such people on daily basis. They believe in treating or trying to prevent COVID infection through traditional means, such as taking habatu sauda, garlic, honey, and so forth. But of course, these methods, when it does not harm you, but it is not scientifically proven, it's not clinically proven, so it should be taken as maybe as not as a preventive measures to prevent COVID, but to maybe to increase one's immunity or health status. I mean, side effects are expected. Okay, and it depends on our physiological state, but the messages need to come from the local, national, and also state level. including influential community leaders and faith-based organizations. Muslim NGOs must be vocal, must play their part, must play their role to promote the safety and efficacy of these vaccines. We cannot rely on government apparatus alone. Okay, on why the reluctance is primarily due to unsubstantiated religious misgivings and also unfounded fears. Of course, as you are aware, there are anti-vax movements with all these theories saying that you are being tagged by the nanoparticles in the mRNA vaccines, but these are not scientifically proven. It should be treated as hearsay, and we should only act based on data and facts. While some hesitation is expected, especially in any new vaccine, the mRNA is a new technology vaccine. What everyone must understand is the process and care that took place in developing these COVID vaccines, and have faith in the science and also in the federal regulations, knowing that Malaysia is a predominantly Muslim country. And we have to bear in fact that our federal constitution, also it is enshrined in our federal constitution that Islam is the religion of the federation, and I believe that the Ministry of Health work within this framework to ensure that the vaccine being administered to the public, it is religiously safe from any questionable substance. Yeah, and the Muzakarah, the Majlis Fatwa Kebangsaan has been consulted, and has been the Muftis have come to a consensus, and that it is harus, that is permissible in Islam. So that should obviate all the doubts that the vaccine is haram, or the vaccine is not safe for the Muslims in particular. Yeah. As preachers, we are shepherds of our flock. Yeah? We have a social responsibility to the millions who were let go from work due to the pandemic. It's not just not only the ustaz are being affected. It's not only the ustaz who cannot give their daily ceramah in masjid. Okay, to our kids who are socially and also educationally deprived for a year, 2 years now. Okay, and to the elderly and at-risk populations who are concerned for their lives, and for the hundreds of thousands who lost their lives. So we have to play our part. We have to play our role as shepherds of the flock for the betterment of the country and the nation.
There are also some legitimate concerns among Hindus whether the vaccine, the COVID-19 vaccine, contains any forbidden animal products. Yeah, because most Hindus are vegans or vegetarians, so they are concerned. But our Ministry of Health have explained in detail, and also in My Sejahtera there is very detailed explanation on the content and the more information on each of the vaccines that is available in our country, which is the Pfizer and Biotech, AstraZeneca, as well as Sinovac. This is the 3 types of vaccine that is being administered to Malaysians now. So for viewers' information, especially among Hindus, the COVID-19 vaccines are indeed safe and effective. Yeah. Okay, this is the message that we at Malaysia Hindu Sangam would like to deliver to all anti-vaccine preachers out there. Okay, and the vaccine protects us from horrible side effects such as admission to the intensive care unit, okay, need for respiratory aid and all those things. If we want to avoid this condition, then it is very, very advisable that we get vaccinated as soon as possible. But before that, you need to get registered to get vaccinated first. So we are worried. Basically, everyone in this country, every individual, we are worried if more people are into this situation. Okay, so we really urge that Malaysians, to don't ever hinder our effective immunization, COVID-19, National COVID-19 Immunisation Program, which is going extensively because our government is towards herd immunity, which is to vaccinate from 70 to 80% of our citizens. That is the best way to eradicate COVID-19 at the moment. So basically, how the Malaysia Hindu Sangam have been effectively informing this information to all Hindus, especially Hindus in our country, is from the very beginning of the COVID-19 pandemic, which started last year in March. We have taken proactive actions by giving clear instructions to Hindus as a whole, especially to Hindu organizations and also temples, because these are the places where basically devotees go for prayers and all. So the SOPs which was stipulated and is being still encouraged by our National Security Council and also the Ministry of Health. This is the basis that we can do as citizens to abide to the SOPs. They are helping the citizens to get registered. Those who are not able, those who don't have phones and are not able to register via laptops or computers, they make the facility so that the citizens around the area come and register so that they will get vaccinated as soon as possible. Basically, Malaysia Hindu Sangam also sits in the Malaysian Consultative Council of Buddhism, Christianity, Hinduism, Sikhism and Taoism. So all the 5 main religious community is also agreeable. We have concertedly agreed that we have to totally encourage all our citizens, withstanding which race, which religion you are, that this is a national program and the COVID-19 pandemic is a national issue, national concern. So each and every citizen in this country have to play their role, their responsibility to adhere whatever that is being put in place, the plan and also the policy of our government as well as the Ministry of Health. So it is our responsibility that every citizen who are 18 years and above, you must register and get vaccinated as soon as possible when your turn arrives. We really do not want any parties, any preachers, in any religion, to go against what the whole world is expecting to reduce. That is getting away from this pandemic as soon as possible. But if you hear from our Ministry of Health and also experts in the medical line, they are quite sure of the situation, and they are saying COVID-19 is here to stay for a while. So if you do not get vaccinated, we are harming our own self, our own family members, and the community as a whole, and the nation as a whole. So those who are 18 years and above, you have to get vaccinated as soon as possible. So don't get influenced. Do not get influenced, because with the advancements of social media and in various ways how people get information, fake news and all that, don't get influenced. Get the correct information from the right people, either Ministry of Health and the doctors and those from medical practitioners, regarding these issues. Don't get influenced by viral information, so, and get ourselves affected by this COVID-19. So lastly, this is what I would like to say on behalf of Malaysia Hindu Sangam, that it is the responsibility of each and every citizen of this country, to fight COVID-19 pandemic in our own way. So the own way that I say is to take care of ourselves, to take care of our family and the community that's around us, and also to adhere that we have to vaccinate ourselves first. That is the first step that we need to take in order for us to save ourselves, save others. Thank you very much.
You know, in this COVID period, we are realizing people are very getting depressed, and their mental pressures, and some of them face very difficult life challenges. Maybe they lose their job, or they are confined to a small space. You know, so all these things work on the mind, and then maybe after a while they begin to think that it is God punishing them, or you know, this is a evil thing, and you know, it should go away. And so people are prone to respond to some of the inner fears that they may have. I have found a number of postings forwarded to me, and some of them speak about some element of supernatural influence in the spread of the pandemic. And usually what we do is we respond back by saying that this is not true. Of course, you are entitled to interpret events as you wish, but there is a science that is acceptable to all, and that is the responsible thing to do is to follow the strict SOP, and to also register as soon as possible for the vaccination. We encourage all our believers, the Christians throughout the country, that we will do our duty, that we will uphold each other in this period, and be responsible by participating in this vaccination program. And if we know of anybody in need and have difficulty in transport, or have fear, to let the church authorities know, so we can do whatever we can to help everybody get on board in this national vaccination program. And in this pandemic, which is very contagious, the only way to be responsible to ourselves, to our neighbor, and to God is to encourage vaccination.